This helmet is one of the most common treatments for a baby's flat head. But how do you know if your baby actually needs one of these? Today I'm going to show you how I decide when a helmet is appropriate, when it's not, and what you can do at home to help improve your baby's head shape gradually over time to see if you might be able to avoid having to use a helmet. Hi, I'm Cherrick Gordon, a pediatric physical therapist. For more than 25 years, I've worked in the living rooms of real families, helping real babies overcome real developmental challenges, including, yes, flathead syndrome, also known as plagiocephaly or positional plagiocephaly. Before we get started, I want to remind you that I created a free birth to 12-month milestone checklist that helps you track your baby's development month by month. You can download it using the link in the description, print it out, stick it on your refrigerator, and use it to make sure your little one is staying on track. Now, let's answer the question everyone wants to know. Does my baby need a helmet? Before I can answer that, there are 3 questions I ask every single family that I work with who is considering a helmet. These 3 questions help me to decide whether your baby is likely to improve with conservative treatment, whether we should monitor things more closely, or whether it's time to discuss a referral for helmet therapy with your healthcare team. Question number 1, how old is your baby? Age is one of the biggest factors I consider because a baby's skull grows incredibly fast during the first year of life. The younger your baby is, the more opportunity we have to influence head shape through positioning, movement, and physical therapy. That doesn't mean older babies can't improve, they absolutely can. But the earlier we identify the problem, the more treatment options we usually have available to us. Question number 2. Why did your baby's head become flat in the first place? This is where many parents focus on the flat spot itself, but I want you to think a little bit differently. A flat head is usually the result of something else. There's absolutely something that caused your baby's head to be flat in the first place. Maybe your baby always prefers looking to one side. Maybe they have torticollis, where the neck muscles become tight and limited head movement. Maybe they dislike tummy time and spend most of their day with pressure on the back or the side of their head. Maybe they were born premature or simply haven't developed enough movement to change positions frequently. If you don't understand what's causing the flattening, we're only treating the symptom, not the actual problem. We need to get to the root cause. And sometimes there is no cause. Baby might just be born with a flat head. Question number 3 is, can we remove the pressure that's causing the flat spot on the back of your baby's head? This is really the question that guides treatment. If we can safely reduce the pressure on that flattened area and help your baby move more freely, that often becomes a very good chance that we can encourage that head to develop more symmetry over time while we're using some passive techniques that may be able to help you to avoid having to get a helmet. That's why my treatment plans don't begin with helmets. They begin by improving the things your baby does all day long. To help families remember this, I use something I call the BabyMasterPT Head Shape Triangle. I know that's a mouthful. There are 3 sides to this triangle, and every treatment I recommend fits into one of these sides. The first side is positioning. Throughout the day, we want to reduce prolonged pressure on the flattened part of your baby's head. That means using different carrying positions, encouraging side lying when appropriate, using various feeding positions, and giving your baby plenty of supervised awake tummy time that takes the pressure completely off the back of baby's head. You know I love tummy time. The second side of our triangle is movement. Babies reshape their head by moving. The more your baby rolls, reaches, pushes up, does tummy time, pivots, sits, crawls, and explores their environment, the less time they're spending in one position. Movement naturally redistributes pressure and supports healthy development. The third side of our triangle is neck mobility. If your baby has a tight neck or prefers turning their head to one side, we need to address that directly. Improving neck flexibility, strengthening both sides of your baby's neck and encouraging active head turning are often essential parts of helping head shape to improve naturally over time. When all three sides of this triangle are working together, positioning, movement, neck mobility, we're giving your baby the best opportunity for improvement. Now let's go back to the question we started this conversation with. When do I start thinking about a helmet? Every baby is different, and helmet therapy should always be discussed with your pediatrician and, when appropriate, a craniofacial specialist or another qualified healthcare provider. In general, I start more serious conversations about helmet therapy when a baby is older. The flattening is moderate to severe, the head shape isn't improving despite conservative treatment, and we've already addressed the underlying cause like positioning and neck mobility. On the other hand, younger babies with mild flattening often respond very well to conservative treatment. As they begin rolling, sitting, crawling, and becoming more active, we frequently see gradual improvement in head shape over time. One question parents ask me all the time is, will my baby's flat head get better on its own? The answer is, it depends. If the reason for the flattening has been corrected, your baby is moving well, spending less time with pressure on the flat spot, and continuing to gain new motor skills, many babies do show meaningful improvement. But if the pressure continues day after day because of a tight neck, limited movement, or a strong preference for one side, it's much less likely that the head shape will improve without some serious intervention. So remember these three questions. 1. How old is your baby? 2. Why did a flat head develop? And 3. Can we remove the pressure causing the flat head? Then remember the three sides of a BabyMasterPT Head Shape Triangle. 1. Positioning. 2. Movement. And 3. Neck mobility. These three principles form the foundation of almost every treatment plan I develop for babies with plagiocephaly. One of the most common reasons babies develop a flat head is a condition called torticollis, where the neck muscles become tight and baby has limited head movement. If your baby always seems to look to one side, or if you suspect they have a tight neck, I want you to watch my next video on torticollis. In this video, I'll show you the positioning techniques, stretching, and movement activities I use to help babies improve neck mobility and address one of the most common underlying causes of a flat head syndrome. Because it doesn't mean anything if you're trying to address the flat head on its own. You need to address the cause, and a lot of times that cause is torticollis. I will see you over here in that next video.